is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here in St. Clair County. And with us, as always, is Dr. Annette Mercatante, the St. Clair County Medical Health Officer. And we're back after a week of being unavailable, so thanks for joining us.
Welcome back.
With that, we'll go right into the stats if we can get them.
And guess what? Everybody's still here, and the virus is still doing its thing. Imagine that. Yeah. Go ahead, Justin. Start off with the data.
Well, yeah, I was just waiting for it to come up on the screen, but so we'll run it down here. 17,578 new total cases, with 711 hospitalized, 381 deaths, and 9,633 recovered. Changes in the last 7 days, 348 new cases. We're averaging 49.7 average new cases per day, 395 average tests per day, and we are right now at 15.4% positive for this 7-day rolling period. The next slide that we would be showing you is we have significantly dropped from the peak back around March 20th, 25th, somewhere in there, of around 260. There we go, 260 cases, and we are now down to that under 50, which is good news, but we still have quite a ways to go. And then the next slide, this is our percent positive for testing. You've seen it quite a bit. What is also interesting on this is all of the peaks in testing are kind of coinciding with the peaks in cases. As you heard a minute ago, we are off from our 700 plus cases or tests per day, and we're averaging a much lower number. So more to follow on that later. This is our vaccinations per week. Total number of doses administered is 95,324. For first dose completed, we've got 57,672, and people complete with their vaccination is 44.1%, and that's 44,182 community members have been fully vaccinated. The good news is our 65 and older is right up there, just short of 68% at 67.9. And then, as always, you can get our dashboard at any time at stclaircounty.org/offices/health/COVID19.aspx.
You know, someone asked, I think, earlier when I got back, one of the questions was, how come we keep doing cumulative cases all the way back from previous to this year? And it's a great question. I think it's because we're still trying to track a pandemic, but at some point we'll be tracking these on an annual basis like we do other communicable diseases. But for now, we still want to know the impact of the pandemic as a whole. So.
All right. Doc, do you want to go over some of your talking points?
Yeah, probably the biggest thing and probably the most consequential is some of our changes in quarantine. As cases come down, as I promised, we would revisit the quarantine issue. If you remember, we were sticking with the 14 days as cases were surging. We just felt it was a bad time to readdress quarantine. But the CDC and the MDHHS have weighed in on shorter quarantine periods and criteria that have probable slightly increased risk, but at the same time, no demonstrable major impact on the reality of disease spread. So simply said, we've gone back to 10 days of quarantine. Now there's some logistic changes. We want to make sure that our documents and everything else and the calls that you get from the state are reflective of 10 days, and that actually takes a little more time, but we have allowed many individuals who have been quarantined at 14 days to go back after 10. And in the same token, we've had quite intense conversations with our school districts, Lots of kids getting quarantined because of their classroom seating arrangements. CDC has clearly said that 3 feet distancing between students in a classroom that follows good masking mitigation. Everyone's wearing a mask. No one's going to school sick. No one's going to the classroom while they're in quarantine. That there's several studies now that support that 3 feet distance. It does not increase the risk any more than if you use 6 feet. So it seems the same numbers come back positive. And quite honestly, our experience now in the last 15 months, as well as I think nationally and certainly statewide, is there's not a lot of kids that get sick in the classroom from classroom exposure. Kids are getting sick because of outside the classroom activities. So with all that said and done, we are allowing within the classrooms only, K through 12 only, and only if the classrooms are following all of the other recommended risk reduction mitigations, specifically masks and cleaning, etc., that we can use a 3-foot basis for determining if an individual had a high-risk exposure to a case in the classroom. What that has allowed is a lot of kids continuing to be able to be in school. And at the end of the year, that has dramatic impact as well. We just really want our kids to balance the need to be in school with the balance of worrying about whether they've been exposed. So we're going in that direction, and we're going to watch closely and communicate very closely with their schools and see how this goes. So that's the newest news about quarantine changes. So that's been my big news. Justin,
Okay,
do you have anything to share?
I do.
Yep.
I have a couple things. So number one, we have a walk-in clinic going till 6:30 p.m. tonight. It has continues to have second dose Moderna and Pfizer, and we also have first dose Pfizer for anybody who can make it over there today. So feel free to head on over to the nightclub in Marysville, and they'll get you taken care of for any vaccine needs. Also, MDHHS issued a new order that's effective today through the 31st of May, and it has some very noteworthy items, such as masks are not required now unless a gathering has over 100 people and that is outside. Masks are not fully required, or are not required for fully vaccinated individuals at a residential gathering. Masks are not required during active practice and competition for non-contact sports that are played outside. For example, you would need to mask up in the dugout, but you don't need to wear it when you're at bat or playing out in the field. Fully vaccinated youth athletes, 16 plus, no longer need to undergo routine weekly screening or 3 times per week screening if you're in a contact sport. That has been waived. And you can find the link to the full order that includes all the infographics and other information, including FAQs, on scchealth.co.
All right, thank you,
That's
Justin.
all I have.
All right, so let's hit the questions. We got a lot of them last night, so we'll try to get through these as quickly as we can so we can get to the live questions from today. All right, Dr. Mercatante, if the FDA approves the Pfizer vaccine for 12 to 15-year-olds next week as expected, how soon will the county start taking appointments for that age group?
As soon as it's been announced that is the new allowance. So if I remember correctly, as soon as the ACIP guidelines are published, we will accept reservations. And as you know, as we just said, we're accepting walk-ins. Remember, that will be for Pfizer, but we are providing Pfizer at our Knights Club clinics as well as some of the other clinics. So as soon as it's approved.
Okay, thank you. Justin, this has been a common question lately. So if people are residents of Michigan but receive their vaccines in another state because they're snowbirds, how can you explain that to people?
Sure. So everybody take their vaccination card to your primary care doctor, and they will input it in the MICR for you. And while they're doing that, they will also take a look and see if you're missing any other vaccines, and work you through that and talk you through that. It's also beneficial for them to make sure that they update that record. That way, if you should lose your card, you can still go back to your primary care doctor, and they can basically print out the information that is on your card currently.
Okay. Thank you.
Yeah, and I guess the important part there, I just want to emphasize that these immunization record inventories do not, from state to state, do not talk to each other, unfortunately. Right. So is that, yeah, they don't talk to each other. I don't think there's any exception to that. So if you get vaccinated somewhere else, it'll be in their system, but it's not going to be in our system. So it does need to be done kind of the old-fashioned way by bringing your evidence in and letting us do it, or letting your primary care do it.
So this would also then relate to college students who may have been vaccinated in other states as well.
Yeah,
correct.
Right? Okay, they come home for the summer, possibly. They would want to do the same. Okay.
Now, we
next
would
question.
need evidence.
One
more thing about that, because this has come up.
Yep.
We do need to see your card. We can't take your word for it. So we need evidence that you received that vaccine to put it in, because we have to put it in under like an historical component. And so if you've lost your card, you're going to have to call the state you got vaccinated in and maybe get it that way. But you can't just call us up and say, hey, could you put my vaccine status in? I'm so and so at this address. So just make sure you know that.
Thank you. Okay, the next question. My 14-year-old grandson was diagnosed with COVID on April 9th. When vaccine is available for him, will he have to wait a certain amount of days to get it?
Okay, we've gone through this before, but let's go over again. If you have COVID, if you are a case, you are ill from COVID, or you've been tested positive for COVID, you need to wait 10 days till you are considered non-infectious, and then you can go out to the world, including go out and get a vaccine. Now, we also want you to be feeling better, and some people don't recover within 10 days of COVID. Even though they're not infectious, they may still be feeling pretty crummy. So it would make sense to wait until you feel like you can walk around the house pretty reasonably without feeling cruddy. So that's so 10 days and feeling better. Okay. Now, if you're quarantined, because we have that question as well, we don't want you to get vaccinated when you're quarantined, because you could potentially be exposing when you're quarantined, you're not supposed to be going out and exposing yourself to other people, right? So it doesn't mean you just can't go to school. It means you can't really do things when there's other people around. So we would ask you to wait till your quarantine has expired, and we did say 14 days, and now I just said we're accepting 10 days. So after 10 days, your quarantine, as long as you're not ill, and during that 10-day period, you can go and get your vaccine. So it makes it easier, 10 days and 10 days.
So just to clarify one more thing, Doc. So for students, it's effective immediately, but for the general public, that's May 10th. That will change.
I think officially we're going to start Monday, because we have all that paperwork and documents to change over, et cetera.
Okay.
Correct.
Okay, thank you. All right, Justin, when we report these deaths daily, are they all actually COVID cases? Like for Monday, May 3rd, it was reported that 12 people died for that day in St. Clair County.
So yes, we only report COVID deaths. We don't report COVID-related deaths in our death count. So the other issue is, say that's what. Anyway, so
no. What I was saying is that it's not necessarily they died that day. It's when we get the final death certificate that confirms it.
Yep.
Yeah.
Yeah. So we didn't have 12 people pass away on Wednesday or Tuesday or whatever the day was that the question is about, 5/3 Monday. I'm sorry. We didn't have 12 people die on Monday between Sunday and Monday. What happened was the records got back to the health department that said we lost 12 people in the community. And so that's how that happens. We're not losing people. We're not losing 10 and 12 people per day, but that's when we're getting the information so that we can promptly report the data to you. Another thing that's really important is, we've talked a lot about the data being a little bit laggy. It's going to continue to be laggy, and that's why we get these groups of death reports in. Although today we had I think 1 or 2 reported. So we are slowing down, we think, a little bit. But this disease has always been a little sketchy and kind of hard to get our arms around. So
okay.
The other part of that, Jen, I'll just add this too. Death reports are only deaths in St. Clair County. If you are a resident of Macomb or Wayne, but you die in a St. Clair County hospital, your death report goes back to the county you live in. It does not stay with St. Clair County. So we are only reporting St. Clair County residents' deaths at this point. That's a done deal.
Okay,
Thanks,
Justin.
that's where some of the shuffling comes from too, right? Where
That's
we
right.
have to investigate these deaths and find out that they don't belong to us, etc. Okay.
Okay, next question. When diagnosed with COVID, do you have to be symptomatic to request monoclonal antibodies?
Yes. You also have to be over the age of 18. You have to have very specific eligibility criteria that is based on the criteria that these monoclonals have had emergency use authorization based on. So there's a long list, and it is best to speak to your physician about whether or not you qualify for that or not. But you do need to be symptomatic, and you do need to be within 10 days of the onset of your symptoms, and to be an adult and over 40 kilograms. There's a variety of things that you need to qualify for.
Okay, next question. Why can't I get tested for antibodies before making a decision on whether to get a vaccine, and where do I go to?
Well, you can get tested for antibodies. The point is, I don't know how it will help you with your decision. We don't know what an antibody test means as far as your immunity, how robust it is, how long it's going to last. We do know that after natural infection, antibodies tend to taper off and wean away, which is why we recommend vaccine even in people who've been infected, because we know the vaccine provides a much more robust, reliable immune response than natural infection. So you can get an antibody test, but I don't know how I would advise you to. I wouldn't suggest that if your antibody test is positive that you would forego vaccine. Right? Nor could I say that if your antibody test is negative, that means you've never been infected with COVID. It may just mean that your antibody test is undetectable, and we know that there's a memory response that can kick in. So it's not that you can't get antibodies. It's just I don't know that it's a reliable way of making a decision on whether or not you should get vaccinated or not. In fact, it's not a reliable way of making a decision on whether or not you should get vaccinated or not.
Okay.
Did I miss anything,
Jen?
Jen?
Can I throw something in?
Yeah, go ahead.
No, Doc, you didn't miss anything.
Okay.
I want to talk a little bit very quickly about the emergency FDA, what Doc just said, the emergency use authorization from the FDA. That is an approval, basically a fast-tracked approval to any sort of medicine, whether it's a vaccine or a treatment or anything that the FDA does. So that does not mean they took shortcuts. That does not mean that they didn't do what is required to get a drug supported by the FDA. And in our vaccine situation, the reason that those things happen so quickly is, one, we had a lot of governments around the world, including our government, who worked on ours, who threw a lot of resources, money, time, scientists at something that normally the government wouldn't get involved with. It would be up to the pharmaceutical companies to make that happen. So yes, the vaccines did happen within a year, but one, they finished their trial periods, all 3 levels. They were looked at very heavily by the FDA, the ACIP, and other groups, and they are ready for prime time. So
it's ironic. I just want to say this. Ironic. The process of approving a life-saving drug or vaccine was put in place after 9/11, because we realized that the process that we had, the standard process, would take so long that it would be unacceptable loss of lives in an emergency. And it's ironic that this process now put in place is worked so well, and people are using that reason for why they don't want to use the vaccine. The process was put in place so that we could bring life-saving treatments to the public and use them outside of this laborious, let's just face it, we know bureaucracy is slow. And the FDA approval for new drugs and therapeutics is slow. So if we didn't have this process in place, people, we'd be talking a whole different story right now without these vaccines being here. So I just think it's kind of not, it's not kind of, it's ironic that a process put in place to do exactly what we did, exactly in this kind of a situation, is somehow being thought of as a substandard approach. And it's actually a success, quite honestly.
Yeah.
Thank you. Okay, next question. I've heard both sides, so I just want to know, is the UK variant more or less deadly?
I want to know too. There's mixed studies on this. Most of the studies suggest it is just way more contagious. And as a virus that's way more contagious, you're going to get a lot more people who get infected. And as a result, you're going to have a lot more problems and a lot more people in the hospital. There are some concerns that it may land people more in the hospital, but for the most part, the consideration is that it's more contagious, but not more lethal. And the more important part of this is that the vaccines, the monoclonal therapies, do still are effective with that particular variant. So that's the good news.
All right. Now this has been a real, this next question has been very heavily talked about lately, especially on social media. So we'd like to clear this up. Excuse me. Do you shed the virus after you get vaccinated?
Okay. So shedding a virus, if you have a virus enter your body and the virus goes down to your cells and replicates, right? A virus is just a genetic material wrapped in a protein coat. So it has to use your cells. It replicates. Those little baby viruses, virions, explode in your cells and are released. And that replication of virus is then, those viruses then are excreted in whatever body tissue just exploded. So if it's in your nose, it comes out your nose and your throat. If it's in your stools, it comes out when you defecate. So viral shedding is the process of the viruses having replicated in your body and then being shed outward that will then be contagious to other people. You're assuming here that the viral shedding, these are live viruses that can then infect other people. The vaccine does not have any virus in it. So it can't get into your body and cause viral replication. It cannot cause viral infection. It doesn't have a virus component in it. So no, you cannot have any viral shedding with the vaccine, nor do you have any viral infection with the vaccine. Now, there are vaccines that use live attenuated viruses. There's a couple of them out there, and this is when the virus is used whole, but it's manipulated so it cannot cause a disease in your body. And in those situations, the virus can shed. Not any of the COVID vaccines are using this at this time that we have. But in those situations where you do have a live virus vaccine, the shedding of that virus is not infectious because it's a vaccine virus that has been made to be incapable of causing disease. So it therefore doesn't cause infection. So, the answer is simple answer. It's absolutely not. COVID vaccines cannot cause any viral shedding. It's just implausible. Doesn't make any sense. But in the sense of, if you're confusing this with a live virus vaccine, in those situations, viral shedding has been reported, but the virus is not infectious or contagious in any way. And that's almost a completely separate conversation from what we're talking about with COVID.
All right, thank you. All right, excuse me. Pardon me. We're going to move to the live questions. First, we have Bonnie. Thank you for everything you do. The Air Force Career Counseling. Thank you for all you do. Kim says to Justin, thanks for doing a great job for the county. She remembers you from the Coast Guard. You've always been a shining star. Thank you for your hard work. Next question is, what class of people are still getting the virus?
Our first slide shows that. You can see the age distribution. All ages from 2, what was that? Our youngest, I think, was a 2-year-old, to every age. So every age. The majority of individuals getting 60% are between the ages of 30 and 69. That's our sweet spot. 10% are over 70, and 20%, almost 20%, are between the ages of 19 and 29. So it really is across the board.
All right. Somebody was wondering if their daughter who lives in Lexington could come to Port Huron for a vaccine because she wasn't having any luck in Sanilac, and a couple people answered that she could go to Huron County and
right. We don't check
so.
IDs. We don't check IDs, and quite honestly, we have enough vaccine. Our problem now is that we don't have enough people trying to get the vaccine. We're sitting on enough vaccine to give anybody. So if you know somebody that needs a vaccine, a family member, if you know them and they're potentially communicating and interacting with anyone in this county, it's a value to get them vaccinated. So send them our way.
Somebody did,
and I don't believe there's anyone. Go ahead.
Somebody did comment that there is a clinic in Sanilac County they could go to too.
Sure. And I was going to say, I don't think there's any clinics statewide that are requiring any kind of residency ID, to be perfectly honest with you. I don't think any county is really restricting people because of where they live.
So the next question is from Kathleen, and she said they received their vaccine out of the county, but they still live in Michigan. Does the health department get that information?
Yes. Yes. Yeah. So if you're in Michigan, it will get into your record, and we can see anybody in Michigan, your vaccine status.
All right. Next question. How many kids in sports tested positive this week at the schools?
Oh, God. Do you know that? How many kids in sports got tested positive? Well, number one, I wouldn't be able to report on this week because we don't have the end of this week. I don't even know if I can report on last week's, to be honest with you. Yeah, it takes a while to collate all that stuff and put it together. And certainly there's a certain variation on that based on whether the kids are actively doing their sports and, whether they're getting tested or if they're in between sports. Justin, do you have any insight on that? I would imagine the individual school districts and teams have that information, but we don't have it yet. They do.
Yeah, they do, and they're actually required to report them on their school district website every week.
There you go.
Once a week.
That's where you go for that. Yeah.
Thank you. All right. The next question is, if someone got their first dose somewhere else, can they get the second dose at the nightclub, or do you have to go to the same site for the second dose?
You should go to the place where you got the first one, but if your only option is to go to the nightclub, then go and get that taken care of.
Also,
there's anybody away.
At I believe it's Ford Field. Anyone who is missing their second Pfizer shot can go before, I believe it's May 18th. So they should check that out too. Okay. What strategies are being used locally to heal moderate to severe COVID?
Well, we only have a couple. We have the monoclonal antibody that is indicated for pre-hospitalization. So if you're not sick enough to go in the hospital, but you're having the right myriad of symptoms and you have the right risk factors, you can receive monoclonal antibodies. If you land in the hospital, you will also receive an antiviral drug called remdesivir, and there's also steroids that they use. There's a standard criteria for hospitalized patients, and depending on where you're going with your disease. Quite honestly, that's about it. Zinc. There's some vitamins that people recommend, and that's about it. We don't have a lot of therapeutics for this disease yet.
So Wendy asks, is it possible to get a second dose Pfizer at the YMCA drive up at the end of May? Kind of the same question that the other person asked, but just specifically the why.
Oh, I don't know enough about that clinic and what product we're using. I'm sorry. Does anyone know that? We'll have to get back to you on that one.
I don't recall.
It would depend on what product is going to be used at that particular clinic and whether we're going to have both products there, etc. So you know what? You should send your request into our COVID-19 email, COVID-19@stclaircounty.org, and we can get that specific information back to you, whether that's a legitimate place to get it or not. I hate to send you there and you not be able to get it.
Okay, Cecilia, or Cecily, sorry if I'm saying that wrong, says, we were supposed to have a healthcare worker start working in our home. We were informed she was exposed to COVID last weekend. What is reasonable for us to expect? Her agency wants us to let her work here later this week if she has a negative 3-day COVID test. What do you recommend for our safety? We have had our vaccines. Hubby is disabled with severe Alzheimer's and Parkinson's.
Well, number one, kudos to you for having your vaccines. That's probably the single most important thing. And if you've been vaccinated, there's a good chance that you'll be protected. Typically, though, I can say the right thing for especially a healthcare worker that's been exposed is for them to stay quarantined for 14 days. And there is no testing out component that we recommend for quarantine. Now, I just mentioned that we're going to reduce that quarantine level to 10 days, and I think in circumstances that's reasonable, but for a healthcare worker who is going to be working around vulnerable individuals, I think 14 days is more appropriate, and I don't think a testing out option is reliable, to be honest with you. So I would recommend her to wait till the end of her quarantine. And number two, I would certainly hope and wonder whether that healthcare worker was vaccinated as well. Obviously, she's not, because she wouldn't be in quarantine if she was an exposure with if you've been fully vaccinated and are exposed, you don't have to quarantine. So that's the good news about that. So to be perfectly safe, that would be my suggestion.
And to be clear, there is no 3-day anything in any CDC guidance.
Yeah. No, I've never heard of that.
The shortest is 7 days with a test, but we're not doing that in Michigan yet because our positivity rate's so high still.
Yeah, that, and it's quite honestly, it's kind of complicated to do testing people on the right time of that, and make sure that the information is properly matched with the person. So the 7-day testing option is complicated, and that's the main reason. Plus, it does increase the risk of post-exposure infection. There's at least a 5% breakthrough rate with that process. So again, you wouldn't be wanting to use a quarantine process in situations where there's higher risk individuals involved. You want to stay with the more reliable 14 days. It's after 14 days, it's very unlikely that you will get an infection as a result of exposure after 14 days if you're not symptomatic.
Okay, Allison wants you to please remind employers to be aware of the safety protocol requirements of MIOSHA, even if the MDHHS new regulations loosen masking.
Yeah, Justin, you want to cover that?
Certainly. So remember that all of these things that we're talking about are for private individuals. Anybody who is at work or anybody who owns a business, a company, anything that MIOSHA has jurisdiction over, they have still set an emergency rule that requires you to be masked while at work. And there's some other requirements as well, such as documenting who comes into your business and doing a screening for all those folks. So also remember, if you are a business, to retain all that paperwork, because they are going back and checking to ensure that you follow the process as required by an emergency law. So, a rule. It's not a law, it's a rule. So.
All right, thank you, Justin. Cassandra wants to know, why did the new orders not include people that have recovered from COVID in the same category as those that are fully vaccinated? Studies have shown robust immunity after natural infection. It seems strange to discount that and only allow fully vaccinated individuals more freedom.
Right. I believe the current guidelines allow exemption from quarantine for 90 days after a natural infection. And that's because the studies show that that is the duration of time we're confident that reinfections are rare. It's very rare to get reinfected within 90 days. After that, it's well documented that it does happen. And I just mentioned that we also know that natural immunity in many individuals appears to wane after that period of time. So there's a lot we still don't quite understand about this, and we have to kind of patch studies. Remember, a single study doesn't prove anything. It just gives them some guidance, and we have to go with the body of evidence that we have, including the body of evidence of the real world. When do people get reinfected? Well, it's beyond that 90 days, but they do get reinfected. So that was the rationale behind using those criteria. And we know that antibody, not just the antibody protection, but protection from the vaccine is more prolonged as we've kind of, remember we said initially 3 months and now we have 6 months. It's going to keep extending as we know more. So I hope that answers your question.
All right. Peter asked, are you aware of vaccine shedding? And you kind of covered that early on, but
no,
maybe he missed
vaccines
it.
don't shed. These vaccines don't shed. And as I mentioned, live vaccines that are not currently any COVID products can shed vaccine virus that cannot infect. So they're two separate issues. COVID vaccines do not cause viral shedding because there is no viral component in them.
Thank you. Gail asked, how soon can I get my vaccination? I had SARS COVID and I had the monoclonal antibodies just a week ago. I just want to get my vaccination.
So if you've been sick with COVID, you got to wait till you're out of isolation and feeling better, as I mentioned, 10 days. But if you've gotten the monoclonal treatment, you need to wait 90 days because that product continues to circulate in your system and will continue to fight off your immune response towards COVID. The concern is that the monoclonals will nullify or negate the value or the effectiveness of your vaccine. So without knowing more, we're going to have to ask you to wait 90 days, which obviously that's also the period of time we feel comfortable that you have natural immunity that will protect you. And I know I had the same situation. Just put it on the calendar when that 90 days is up and get your vaccine then.
Okay. Alex writes, when I received my first dose a month ago, the nurse who administered a shot wrote down the wrong date for my second appointment, in turn delaying for another week because I had to reschedule. How could this affect the community if this was done for a large number of other people too?
Well, yeah, I put, mistakes do happen, although that in the grand scale of things isn't huge. We do know that there's a grace period of that second dose up to 6 weeks after the first dose. So a couple weeks delay is not going to cause you any immunity issues. It'll delay your full vaccination immunity capacity, of course. But I can also tell you that as we learn more about these vaccines, it'll be very surprising to me if delays even longer than that have any profound impact on the overall effectiveness of the vaccine. Most vaccines that require more than one dose, the intervals between them, it's a problem if the intervals are too short. But if they're longer than recommended, the immune response remains quite good. So all I can say is we hope that doesn't happen on a regular basis.
Okay. Peter asked, why do we need to show you evidence if of a vaccine, I think he means.
Because people will lie.
All right.
And obviously vaccine status is going to end up being pretty darn important, right? In our community, it already is. There's already situations where fully vaccinated people can do certain things where unvaccinated people have a much higher risk of doing those things. So we can't just willy-nilly put things in because you said so. I wish we lived in a different world where that were true, but it's not.
Janine ask, I was sick with double pneumonia after receiving my first vaccine. I was scheduled today for my second dose. However, I have 2 days left of my steroid. How long do I have to wait before getting my second dose due to the steroids?
10 days, 14 days. I think it's 14 days, to be honest with you. I'd wait a couple weeks, especially if you've been on large doses of steroids. I believe it's 14 days. Janine, do me a favor. You're another one that there is some specific guidance on this, and I'm a little bit rusty on it. So if you could send your question in to our COVID-19, I'll double check that with our CD specialists and make sure I'm not misadvising you. I think it's 14 days, but it could be a little longer. I'm not sure. So please send your request into our hotline. Thank you.
June said that she was at our second Pfizer shot at the nightclub, second dose Pfizer shot at the nightclub last week, and she said everyone was great. And thank you. So that was nice. Christina asked.
Yeah, no waits. Not
Christina
anymore.
asked,
No waits.
what I don't understand is Florida people aren't wearing masks and they're not social distancing. How are their numbers lower?
So I'll take that actually. So what I will say is people in Florida are now not mandated to wear masks, but when I was in Florida for a quick stop, I will tell you that they are using and wearing masks in many, many places, regardless of a mask mandate. Now, there are some other environmental factors, such as we know that it doesn't spread as well when it's hot outside. Florida right now is in the mid 80s. And so there's a lot of environmental things. Lots more people in Florida are outside. There's many, many things that really impact this. Here in Michigan, it's still cold. I mean, it's like 50 degrees outside. People don't hang out by the pool at 50 degrees when it's overcast. So there's a lot of differences between Texas, Florida, and Michigan. Go ahead, Doc.
Yeah. And I also just want to caution people that don't be so quick to judge. India was touting all over the place that they had overcome the virus and they were moving on and they did, and look what's happening in India. So all I can say is please don't underestimate this virus. There are a lot of variations we don't understand. There are variations in data collection too, I might add, what they count as cases and how they count cases. But I think the real issue is we don't know what we don't know, and what do they say? It's not over to the fat lady sings. It's not over yet, people, and we don't know that Florida's numbers are going to stay low. So we just need to kind of keep doing what we know we should do, I think.
Peter says or asks, if it's so robust, why are they talking boosters? I got vaccinated against smallpox, one shot forever.
Smallpox and COVID are very different. Very different. But Doc, go ahead.
Well, yeah. So they're two different germs. I don't believe the smallpox mutates at all. In fact, it's no longer a threat anywhere there's no natural smallpox anywhere in the world anymore. Thank you to vaccines, by the way. But yeah, you're right. Different germs respond to different types of vaccine. I mean, look at the struggles we've had with HIV. We still don't have a reliable vaccine for HIV because the nature of the virus itself, and the nature of coronavirus is that it mutates when it replicates in the millions, gazillions, billions, and it mutates. And so that's where the consideration that we may need a booster, because we can just, as now that we're tracking these variants and the number of mutations that are occurring, it's quite clear that chances are it's going to mutate to the point where our immune response with the current vaccines may be altered. And I use the word may because I know that, the pundits that were weighing in, but we just don't know yet, quite honestly, what we're actually going to need going forward. That's going to take observation and good science and repeated review of the data, which people can't stand because they just want to know like what's happening and where is this now. And this is a evolving pandemic with a novel virus. And I can tell you after 15 months, there is no way we have the science and the understanding of this to be able to give you concrete answers like that. So more to come. Check back in a few years. I might have a better answer for you.
Janine wants to know, where can we go for an antibody test?
Oh, I think you put that down. I think Kroger Pharmacy and LabCorp has a at-home test. You can go to our website, scchealth.co, and we have a list of places you can get antibody tests. Just remember that you can't use your antibody results as a reliable indicator for your immunity. Please. It's a false sense of security if that's what it will tell you is whether or not you've had COVID in the past. It won't tell you when you had it. And I just talked about, we only know about the last 90 days as being protective. So there's the caveat. So, just be careful how you interpret that.
So Stanzi asks, do we know if vaccines will work against the more concerning strains like the double mutant variant from India?
We don't know for sure. There are concerns about some of the new variants. In some of the we call in vitro studies. These are studies that are outside of the human body. The neutralizing ability of some of the vaccines to the new variants is less. So what does that mean in a human population as far as how well the vaccine will protect us when the infection is actually inside our bodies? Still really remains to be seen, quite honestly. But there's concern about it. I suspect that the vaccine will still be somewhat effective. The question is, it will be effective enough as it stands, or will the vaccines have to be altered to kind of more mirror the mutations of concern? Which can be done, by the way, pretty easily, especially with the mRNA vaccines. That's the beauty of that vaccine, is that those mutations, those genetic sequencing changes can be changed in the mRNA product and then just utilized in the same, manufactured in the same way. So that is the beauty, and that can be done relatively quickly with mRNA vaccines. So that's the good news.
So Kimberly asked, are vaccinated people able to spread the virus to unvaccinated people? We worry about giving it to our children.
Yeah, so that's a big question. We still don't know for sure how well the vaccine prevents subclinical infections and asymptomatic transfer. And of course, you all know that even a fully vaccinated person can still get COVID, although the numbers are much lower than even the clinical trials. I think our official is 70 cases in St. Clair County is what I saw, which is a minuscule amount of cases compared to those who've been vaccinated. But it happens. So you just need to use your head. I think you can be considered as pretty unlikely that if you're not having symptoms and you've been fully vaccinated, that you will get an infection and spread it. But if yeah, that's all I can say. We don't really. I don't have a number for you, but I think it's unlikely, and it doesn't appear to be very common.
So Kathy asked, are we still having a high count of people still getting the virus, and what is the percentage at this time for St. Clair County?
Who's got that?
Yeah, I can do that. So we're
Okay.
still above 15% at this time for St. Clair County for percent positive, but we have dropped below 50 cases per day, which is very good news. So yes, that we still have community transmission going on. I think Doc would agree on that, but we have come down a lot since we were above 250 cases per day.
All right, Brody asks, is the Johnson & Johnson vaccine safe?
Yes.
Define safe. Yes. The question, yeah, the simple answer is yes. The J&J was obviously held suspended because of our very successful surveillance system that detected an exceptionally rare event in women under the age of 48 of a unusual blood clot situation. Less than 1 case per million. And after careful review, that vaccine is now been allowed to be used again, because quite honestly, your risk, and again, we have to look at this relative risk, your risk of having clotting and immune response problems with COVID disease is in the hundreds of thousands per million. Okay, so it's kind of like it's not even a valid comparison. So yes, they did identify a very rare condition that wasn't identified in the phase 3 trials, but it was considered so rare that the benefit of the vaccine far outweighs any potential risk. And so that is the story of that vaccine. Just like in the mRNA vaccines, there is a well-defined risk of anaphylaxis, right? Less than 1 per case per million, which is far less than in the general population. I'm sorry, I might have had that number wrong. But the point is that vaccines carry a small risk, but the risk is much, much smaller than the risk of the disease itself. And that's always how we want to think about this, not whether something is safe or not safe, because let's face it, getting out of bed in the morning is not safe. There is a defined risk of driving your car to work every day, or walking through your yard. So there's no such thing as safe but relative risk compared to what will happen if you don't do something. So I hope that helps.
All right. June asks, is it unusual to have less side effects after the second Pfizer shot? I was expecting to have worse, but I was actually quite mild.
I haven't seen any real solid data on that yet. There's some consideration that if you've had COVID disease and get vaccinated, you might have a more robust immune infection because you already have some residual immune response going on from your natural infection, and that the vaccine obviously would boost that. But whether the first or the second dose is worse, I know my second dose was easier than my first dose, was better. And some people tell me the opposite. And I can't really tell you. Justin, have you heard any data on that as far as one
I've
way or
heard
the
some
other?
anecdotal. Yeah, I've heard anecdotal data that Pfizer is less reactive than Moderna. Just
But
for
that's
whatever
anecdotal.
reason.
I have not seen
That's right.
any good
There's nothing
evidence to
published.
support that.
No.
Okay.
Judy and Fred ask, is there anywhere that do the test that don't put a stick through your brain? Lake Huron is still using them to test. This will make a person not want to test.
Yeah, we haven't used NP swabs for most of our testing in a while. We just do the anterior nasal. There's actually some now that do saliva, although it doesn't look like we're going to have it here in our community right away. It's unfortunate. So yeah, generally you don't need a nasal pharyngeal swab. The data would suggest that it's just as accurate to do an anterior nasal swab. Of course, it has to be done right. You got to put that swab in and turn it so many times, and then put it on the other side and do it. You can't just kind of wave it around in the front of your nose. It does need to go up in there and get some of that mucus, but it's not nearly as onerous as the NP swab is. Those nurses, though, they like to get good specimens sometimes, and it's probably why they're doing it that way.
Heather asks, my mom wants to go to church for Mother's Day. We are both fully vaccinated. We would like to take my uncle, who is developmentally delayed. He has both shots, but it won't be 2 weeks until Wednesday. If we socially distance and mask, how safe would it be to go to church this Sunday?
You're talking a matter of 3 days, and the whole pod is vaccinated. That would be one that I'd say take your chances, especially if it's very meaningful to you. If you want to do some extra precaution, make sure that he masks, right? So that if he's not fully protected and it does get exposed, that will help reduce the viral load that reaches him. So, yeah, again, we go to the word safe, and thank you for putting quotes around that. I think the risk in the situation be relatively low, even though he hasn't reached that ideal mark. In the health department, we have to have criteria. We have to have a number of days because we have to apply it across the whole population and be consistent with so when you ask us about quarantine dates, we go from, how we do it. But when you're making personal decisions about your own household, et cetera, you need to bring into consideration those other things, like how important it is to you, who are the people around him, what is the situation where you're going, and what are you going to be doing there? So those things you take into account, and you just, you make your decision.
All right. Somebody went to the Marysville Fire Department today, and they said they were really caring. Thank you very much. What vaccine is the health department offering? That's from Stacy.
Well, we're sitting on all three. So all three that are currently available are available with us. So in each clinic, we tend to use, so for second dose clinics, we obviously need to use the second doses that were given after the first doses. I think now in our second dose clinics, we take both of them, don't we? And do both Moderna and Pfizer. So some of our recent clinics we're doing J&J because, quite honestly, these clinics are getting so small that trying to do second dose clinics 4 weeks from now may not be of value. So by doing a one and done shot like J&J, we don't have to worry about being back at that space 4 weeks from now. But to answer your question, we do have all three, and as the process goes by, all three products should be available to you.
And do we know if anyone can go get a Johnson & Johnson vaccine before next Wednesday's clinic? I'm not sure.
I'm sorry, I
don't
just came
remember
back
either.
from a break, and I
Yeah.
don't know all the details of all of our
Yeah.
clinics. We have a number of
Send
clinics
us an
going on
email.
each week, and send us an email. We'll
Yeah.
see if we can
Yep.
plug you in.
Okay. Next question. I was told this is from Sandra. I was told people that are fully vaccinated don't need to wear a mask, question mark?
In certain circumstances, that is correct. That is one of the bonuses of being fully vaccinated. Now, if you're in a large gathering, over 100 people in a crowded area, I would still advise wearing a mask. Remember, you're not 100% protected, and the more people that are around you and the higher risk that situation is, the greater your risk. But yeah, one of the benefits of being fully vaccinated is that you can be in your home with other people and not wear a mask. Being outdoors without a mask. I think some of the other things you can play non-contact sports without a mask. Yeah, just a whole variety of things. And remember, these are guidelines from the state. And I get confused by them too. 100, 25, 50, we were just talking about that. It's hard for me to keep track as well. But the idea is if you're fully vaccinated, you're much less likely to get infected if you're inadvertently exposed. Adding a mask to the whole picture just improves your safety profile. It makes it even less risky. So being fully vaccinated is just a huge bonus for you and your family. We talked about earlier, more than likely significantly reduces your ability to spread the virus as well. But the data is not quite there for me to give you quantitative analysis on that, but it more than likely helps that as well. So it's a win. It's a win for everyone to get back to doing the things they love. I know I hug people a lot more easily now. Before, you walk up to a person and you're doing this. If I know I'm hugging somebody else that's vaccinated, I'm meeting somebody else vaccinated, they're getting a big Mercatante hug from me, right? So those are things that I know I feel a lot more comfortable with after being vaccinated. Justin, do you have anything else to say about what vaccinated people can do versus non-vaccinated people?
Yeah, I think you covered it. And we can expect that as the continuing transmission goes down in Michigan and the vaccination rates continue to go up, the requirements now in the state are to have completed after 2 weeks the first round of vaccine for the 2 mRNAs. So that's an important distinction too. That's where they're taking the percentages from. They're not requiring people to be fully vaccinated yet. Just have 2 weeks past your first vaccine. So remember that as well when you're looking at the plans that the state puts in place.
All right, and the last question is from Stacy, and she wondered if the information will be in the text or email that is sent out for people who have signed up. I believe about clinics.
What information are we talking about? Oh, the clinic. So clinic information is being weekly sent out by the CSCB and the Blue Meat Screen. So that is on everybody's website. Jen, do you know where they can go to look at updated clinic information every week? The one that
It's on yours too.
is being put
Yeah,
together.
they can go
in
to our
ours as
website.
well?
We have a link to it, or the cscb.org website as well. I don't know. I didn't know if Stacy was talking about Everbridge when she was asking this question, but I'm not sure.
Okay. And you're still welcome to use Everbridge, but quite honestly, we're going through those appointments as soon as they're in there. So you will be just as quickly vaccinated if you just go and look where the nearest vaccine clinic is. And if it's open to the public, show up there. I can almost guarantee you get a vaccine. We are not seeing long lines at our vaccine clinics anywhere anymore.
All right, and the last question, then we can wrap it up, is from Deborah. She's fully vaccinated but has been on prednisone for years. Would she have protection?
Probably, but I can't tell you for sure how good. That is something I don't believe has been published yet. The studies aren't there to know how immunocompromised individuals fair with vaccine. The concern, of course, would be it would not be as robust, but my guess is you'll have some protection. So a little bit is better than nothing, or more than a little bit. Yeah, I would assume. Now, in this situation, I'm sorry I forgot your name, but if you have this sense that perhaps you are an individual, Deborah, who's not going to have as robust a response to the vaccine, you might be somebody that when you're out in public, especially in enclosed indoor places and with places that maybe have a higher volume of people who are unvaccinated, to be a little more careful, right? I mean, this is why there's no hard and fast rules. If you're a high-risk individual, even vaccinated, you just, play your cards right. Be careful of where you're going and who you're with. And I said it's not over. It's not over yet, and it's getting better. Things are getting better, and I'm hooray for everything. But we can't be stupid about this. And if you know that you've got some concerns and risks, just do the distance masking thing, because those things really do help. I know all the naysayers out there, but the data is really supportive that masks make a difference. So please keep that in mind.
All right, so that's it for today. Any closing comments?
Oh, let me go, because I missed y'all last week, although everybody needs a break, right? So there's COVID fatigue and there's COVID fatigue. So please pay attention to what you need to be resilient and to continue to do this. This is our new reality. So let's go with it. Vaccine. So our vaccines do not cause viral shedding. Our vaccines do not cause fertility issues. These vaccines do not cause deaths. You're not going to die if you get a vaccine and then get COVID. These are myths. These are things that are being circulated and scaring people, and they're not true. So we're going to please, if you have concerns about a vaccine side effect that you've heard about, and specificity is appreciated, because if you have, if you're just broadly concerned because you just are worried, that's a hard one to answer. But please send those concerns to us, and we'll try and address them in a way that makes sense to you. And we realize that sometimes science is hard to get across in a way that people understand, but the time to vaccinate is now. It's now. You can't, I'm going to wait. I'm going to wait on this vaccine. I'm just going to give a little more time. We don't have time. We need to vaccinate now. And so you've got 200 million vaccines out there just nationally, with a very robust surveillance system that would be picking up even tiny little warning signs like what we did with the J&J. So I don't know what more you can ask for. It is a tremendous amount of information out there that shows that these vaccines are effective and they are not causing these dramatic, terrible things that people are worried about. We would know that by now. We would absolutely know that by now. So if you're waiting for something else, please don't. I'm telling you, this is a good time to get your vaccine. Go give your grandma a hug afterwards and get back starting living our lives again. So that's my message, y'all. And thank you all for joining us. We appreciate you coming.
Justin?
Yeah, and I don't have a lot to add. Doc, I think, hit everything, but just I continue to ask the community to hang in there, ask the questions and get the resources that you need to make your decision for vaccination. But obviously, both of us highly recommend everybody that's eligible get the vaccine as soon as possible. And soon enough, we'll get into some warmer months and people can enjoy the outdoors a little more, and we'll look forward to all that. So have a great week, everybody. Thanks, Doc and Jen, as always. And we'll see you next week at the same time.
Thank you.